HP and Celebrate. And this is just going to be a little talk, really starting on my undergraduate dissertation. It's now kind of being transposed to master's and then potentially a future PhD at City starting in a few years' time. So no declarations. This was obviously done as my undergrad at University of Suffolk for my radiotherapy degree, and I did it in liaison with the Society of Radiographers LGBT Equalised group. So first of all, just a sort of a reminder for terminology. So obviously we have the kind of universal LGBTQ plus terminology that we use. Just a reminder that's lesbian, gay, bisexual, transgender, and then the queer, bit of a grey area, whether that's queer, questioning. I sort of go by both, and then you've got the plus, which includes non-binary, asexual, kind of everything that isn't included in the sort of first few letters. So the study context for my dissertation really was around health inequalities and why LGBT patients have a when we look at patient response forms and things like that, they have a worse outcome within radiotherapy and cancer when we go a bit wider than their heterosexual counterparts. So I kind of wanted to find an area that I was interested in to find out why that this was. So a part of my dissertation I had to do was an extended literature review, and so these are some of the kind of figures and areas of interest that I found kind of why LGBT patients are one of the main health inequalities within radiotherapy and oncology. So, as we know, radiotherapy does play a crucial role in cancer treatment. So, it's about 40%. I think that's kind of gone up a bit since I did my dissertation. And really, when we look at radiotherapy as a treatment, we know that in some way or another, they have to have some form of either undergraduate education to become a professional, or that continued workforce education in the form of CPD and training. So this is the area that I then particularly chose. I was interested in whether undergraduate students completing radiotherapy degrees in the UK actually got any training on LGBT oncology. There's only 13 providers of radiotherapy in the UK. The predominantly of them are in England. And then one in Northern Ireland, and then a few in Wales and Scotland. So the person-centered or patient-centered care, whatever way you kind of want to look at it, is needed anyway. But LGBT specific, it's becoming a lot more apparent and included in kind of the NHS plans, the 10-year plan, especially with the recent like legislative advancements of same-sex marriages and other legal advancements like that. So approximately 3.2 to 5% of all adults aged 16 plus in the UK identify as LGBTQ plus. This was taken from the most recent census. Predominantly, as you can see, it's aged 16 to 34. So those 16 to 24 and then the 25 to 34 age range are the ones that kind of are openly have filled out the census data to say that they are LGBT. Quite a lot of LGBT researchers, including myself, potentially think that actually census status is probably biased, and that actually the older generations probably are should be included in higher numbers, but because of that the HIV pandemic, the kind of the stigma around being gay, kind of pre-2000s, that actually probably has been what's kind of shown as to be quite low. So when we look at the sort of 85 and over percentile, actually that's about 2%, for example. And actually we think it's probably a lot higher, but they're just not comfortable in kind of presenting or admitting that. And again, so the bottom graph, the one that's just kind of got a bit bigger now, the one that's blue and orange, is for transgender patients. And again, you can see the similar trends that there is a lot more percentage of the UK population within that 16 to 34 age range compared to the sort of the older generation. And again, the similar biases more so with probably transgender presentation than sexuality. So kind of patient-centered care is been guiding healthcare now for quite a while, but recently it's been getting a lot more prevalent in the sense that we need to make sure that we are individualizing our care specifically to those patients that come into our departments. And LGBT patients have quite a lot of differences in their treatment needs and their side effect needs compared to their heterosexual or kind of cisgendered counterparts. And then these three kind of themes that are now about to come up were the three themes that when I did my literature review that I kind of put all of my literature into. So these are the three areas that any research that is apparent about LGBT health kind of fitted into this area. So the next one was the cancer risk factors. So there are a few slides coming up where I'm going to go into a lot more detail, but LGBT kind of LGBT individuals will and often have a higher cancer risk factor compared to kind of their straight and cisgender counterparts. And it's usually around drug use, smoking, kind of physical activity, obesity, and mental health. And then kind of the healthcare research and education area, which is kind of the more, so is the generic area of what I was looking at was education, is that there isn't any specific research within radiotherapy, diagnostic, or nuclear med on LGBT cancer care or just LGBT care in general. And all of the research that is out there is very, very much only for medicinal medicine students and kind of looking at what education packages that they've had. And there was one article which was 1992, which is for nursing and midwifery students. So it's not uncommon. I suppose a lot of educational and academic research is kind of heavy for the medicine students and nursing and midwifery, and it doesn't quite filter down to AHPs. But for there only to be one in nursing midwifery, that was a surprise that myself and my dissertation supervisor kind of didn't expect. So one of the key articles which kind of I used for when I did my dissertation and when I created the survey to present to ethics and then to go out to all of the students was this article done by Alison Berner. So a few of you may know her if you're in sort of the oncology field. She is a clinical oncologist in London. She is the leading oncologist in the UK for LGBT oncology. And she also leads UCATS, which I'll speak to a little bit later, but which is the UK's transitioning service and cancer service. So anyone who is transgender and non-binary and is having any form of cancer treatment should be referred to them as secondary care. This unfortunately isn't done because I don't think many people know about the service, but I will be advertising them at the end about what the services do, how to refer them, and sort of why they're a good additional service. But this was the only real article that was specifically about cancer. So all of the other articles that I found about healthcare education were very generic to just medicine as a whole, and this was the only one that we could find that was about oncologists. And 258 oncologists were interviewed in person. 65% of those were consultants, and then 35% were trainees. And really, as those the biggest kind of data set that I felt that I was glad to find because it meant that my study would kind of fit into that was that 75% felt that they would benefit from further education. And it's not on here, but 80% of them hadn't had any education whatsoever. So 20% of them had, and that was only, and majority of them, I think, was because they'd done their own personal CPD, but they hadn't actually had any standardized or mandated training, either sort of via the NHS or their medicine schools. We obviously do have the generic NHS EDI sort of modules we have to do when we join trusts, but they were saying that this was kind of generic and encompassed the whole of EDI rather than LGBT specific. Interestingly, only 57% felt it was important to know a patient's gender identity, and majority of the ones that didn't said that actually they would treat a patient the same no matter whether they were male, female, or other, which is quite disturbing because obviously, a gynae cancer patient, you're only going to be female or a female presentation biologically. So actually, you need to manipulate you kind of how you're treating someone depending on what they're presenting with. Again, 29% only wanted to know their sexual orientation. The other percent said that actually it doesn't matter whether you're straight, gay, or other. Actually, they're going to treat everyone the same, which I suppose is quite positive that they're obviously trying to be inclusive, but at the same time, there is a thin line between inclusivity and needing to adapt your kind of care and knowing that actually LGBT patients do have difficulties accessing radiotherapy, accessing cancer screening, and we do have different side effects in total. So for one of the ones, sort of the main kind of cancer risk factors is that LGBT adults are more likely to be smokers, with LGBT women being kind of the prevalence of that. So as you can see on that graph, overall, there's a 27% more likelihood for you to smoke if you're LGBT compared to heterosexual. And you can see that actually, if you then go down by gender, this was women. And in this case, this was women in the sense of biological sense and presentation sense. So transgender, non-binary, asexual, whatever, if they put down that they were presenting as female, then it would fit into the women and male categories. Some of the other ones, interestingly, are 14% of LGBT people avoid healthcare completely and have never had an appointment within the last 10 years. 27% of transgender patients would often avoid GP appointments because they didn't feel like their GPs would understand or be able to help them, especially when it came to cancer screening. In terms of cancer screening, LGBT patients, in the sense, are always the patient group that actually is affected the most in terms of uptake across all EDI. But when you look at it specifically, it's transgender patients which are the ones the most affected. 57% of transgender patients avoid healthcare completely as well. So when you look at that in the 14%, actually, if you looked at specifically, most of those will be transgender. And again, LGBT adults are more likely to drink at harmful levels, which again is potentially a precursor to some cancers. Drug use, women who have sex with women are 2.5 times more likely to have an illicit drug history. Obesity is more common in LGBT patients by 68%, and physical activity is about 35% more likely in LGBT patients compared to their heterosexual counterparts. Interestingly, HIV does have a massive impact on cancer risk factors. So HIV positive men are 40 times more likely to have anal cancer compared to their heterosexual counterparts. So this is then kind of when we now then come into my dissertation. So these were the 4 aims and objectives that I wanted to do when I was looking at my research. So the overall sort of research that I wanted to do was that I wanted to critically evaluate how prepared final year UK radiotherapy patients, students even across the whole of the UK, were to effectively care for LGBT patients, and whether they actually knew the differences in what care they should provide and whether universities were actually teaching it. So as part of that, the sort of objectives came from that aim. I wanted to assess the current education, and then I wanted to assess confidence levels of those students based on their current education. And then, interestingly, as Alison Berner had asked opinions of the oncologists, I wanted to do the same and to see if it was the same for radiotherapy students and see kind of where they sat with whether they thought it was kind of politically correct to ask someone's gender, sexuality, things like that. So this was the one really that was probably the most controversial in my survey and did cause ethics a little bit of a sort of hoo-ha when I was trying to put my ethics over, is that we were deciding whether it was kind of a bit too on the edge or if not. And then recommendations. So I wanted to create some national recommendations and some improvements to all of the HEIs within the UK and to radiotherapy departments that had students in. So it was a very, very heavily qualitative research piece, and this was completed by an online questionnaire. I created this on Microsoft Forms, and then this was sent via the SOR's head of education group. And then this was requested that all heads of the HEIs could then disseminate it down to their final year students. So final year would be third year if you were UK, England and Wales even, and then fourth year if you were Scotland and Ireland and things like that. So made sure that everyone, the reason I chose final year was that then everyone should have, in theory, by the point that they completed my survey, had some form of education across their 3 or 4 years, hopefully. There's approximately anywhere between 250 and 270 students in the final years of their UK radiotherapy studies at any one point in the UK. That's rough data that we get from the College of Radiography every year. So I roughly wanted about 10% of that for it to be a comparable study. I got 24 in the end, so I was slightly annoyed that one more person didn't complete my study because then I would have been bang on 10%. And it was a very heavy thematic and narrative analysis across the study and the literature review, as that's sort of kind of where my research interests lie. So going now into actually kind of the data that we got collected, I had 24 participants overall. And as you can see in the table 2, that the country of study was 63% of it was England, which wasn't unsurprising. We know that of those 13, I think there's about 8 of them in the UK. So we kind of predicted the majority would be from England. We luckily did get some answers from Wales, Northern Ireland, and Scotland. We were hoping that the numbers would be a little bit higher. However, we did get enough that we could compare different countries. We didn't want to ask, it's a little bit of a sort of a grey area because Northern Ireland and Scotland, there's only 1 or 2 universities, so you could potentially work out which university the students study. We chose not to ask the universities because in England there's obviously quite a few more, and at least in England it wasn't kind of a steadfast that you could look at the data and go, well, we know that this is the university you go to. I wanted to understand whether someone's kind of own gender and sexual presentation would actually affect the data that they completed, and whether those who had completed study or felt comfortable with treating LGBT patients, was it because I predicted that being LGBT myself and others who are LGBT, we're more likely to feel comfortable with treating these patients because we are within this community ourselves, rather than it actually being anything to do with the education status that we've had. So unsurprisingly, again, 15 of those 24 were women. Again, not surprising. Majority of the radiotherapy workforce is female, and the majority of the student population is also female. So we weren't surprised with that. We were quite happy that we did get some male. We did get a few. We got one transgender male, which was good because we were quite glad that we got some kind of variety. And then we did get a few people that put other or prefer not to say. And then current sexual orientation, we did get the majority of it being heterosexual. So 54% were straight or heterosexual. You had 17% bisexual, and then the others being varied. So we did have quite a nice variance on the sexual orientation, which was quite useful because when they completed the surveys, when we then got to the open-ended questions where they could complete text, it was quite interesting to note that those who felt comfortable treating patients, as I had predicted, were a member of the LGBT kind of community, either due to their sexual or gender orientation. So the next part of my survey was kind of around the knowledge and awareness. So this is where I wanted to know whether they had had any formal education and then kind of anything around it. So question 5, you can see if had they received any formal education or training on the LGBT kind of issues. So this was around radiotherapy and oncology. I chose to kind of broaden it open because as much as we do get trained only in radiotherapy. We also do treat patients which are obviously having concurrent chemotherapy. They're having other cancer treatments alongside pre or post their treatment. So I wanted it to be as inclusive as possible. And 67% of those 24, which is 16, hadn't had any training whatsoever, and only 8 had. So of those 8, I then kind of wanted to know where their predominant training had been, and the predominance was 55% was at university. We did have 4 people who had had university and clinical placement, so those 4 were same people. So only 2 of those 6 had only purely had university, and then 1 person had done self-study who was interestingly LGBT. So it was interesting to note that that person actually didn't fit my predictions, that we wouldn't need to kind of do self-study or anything, and it was interesting in that sense. And then when we look at kind of where had they actually got the majority of their education from, I had asked them to write this in kind of an open-ended question, so then I could kind of theme it. And so the themes were lecture-based teaching, case studies, external speakers, patient contact, and online resources. So patient contact actually was positively the highest, which means that, they are seeing patients, they're learning from their care, and all of them had noted that post seeing an LGBT patient, that they had gone and done their own reflections on how they had treated them, how there had been issues within the department or staff, how they were treated, and actually what they felt like that could have been done differently. It's external speakers. Both of those had been seen by Outpatients, who I'll be discussing at the end, which is an LGBT cancer charity. So they do come in and do external talks. So they were the 2 that had come in. And then I kind of just wanted to know what topics had been included. And 16 obviously said had no education. 2 of those 8 that had education had gender identity only, and this was only about transgender patients, and it hadn't divulged into non-binary, agender, or any of the other kind of gender presentations. For this study, I also included intersex into the gender identity, and no one had kind of been trained on this. One of the students who completed my survey and one of the open-ended questions later on did note that one of the LGBT patients that they had treated was transgender and intersex, and having both kind of sexual organs and presenting as the opposite gender to the gender to the kind of genderized cancer that they were being treated for, kind of had thrown them a bit, admittingly, and they hadn't had any training. And actually, the department that they were in also didn't know how to necessarily deal with it, how to present to the patient, how to kind of make sure all the side effects and kind of holistic care was specific to that patient. So they did struggle a bit. And then it was very generic for LGBT topics in general. So confidence levels, we had 20 people come back with saying that they didn't feel confident, and a lot of them, majority of them, was because they hadn't had any training whatsoever. And the same for LGBT radiotherapy. This was because a lot of them hadn't, again, had gaps in knowledge or no experience whatsoever. So the predominance on both oncology and LGBT radiotherapy was that they hadn't had any training, so they didn't feel confident treating this patient group. I just kind of got the same question again, just put in a Likert scale, so then you could kind of see the actual exact level of confidence. And again, the majority of it was unconfident. So 54.2% across the 2 questions put together were unconfident in treating LGBT patients. And then this was the kind of the controversial ones that were in Alison Berner's article, and then the ones that I wanted to ask was, do people believe that it's important for them to be aware of LGBT specific needs, and do they actually feel comfortable asking a patient what their gender and sexual orientation is? So majority of them actually did agree that they were comfortable. So 54% said that they were agree or strongly agree was they would be comfortable or strongly comfortable asking someone what their sexual orientation or gender identity are. But obviously quite a lot, it's about a 50-50 split. So interestingly, half and half weren't. And then the sense of being aware, luckily, I think for me, I think I'm quite happy that everyone said that yes, everyone should be aware of the specific health needs and challenges faced by LGBT patients. And I just thought that was quite a positive kind of note to take. So in the sense of clinical experiences, 14 students hadn't had any experience treating. Oh no, 14 people hadn't experienced or witnessed discrimination or prejudice towards LGBT patients, but 10 of the 24 that I had surveyed had. They could, if they wanted to, list what the prejudice were, and a lot of it was just incorrect terminology, homophobia, not knowing how to specify their kind of care specifically to their gender or sexual orientation, and then predominantly was transgender patients coming into a department and them presenting, for example, as female to male, and they'd have a gynae cancer, but obviously they were presenting as a male and things like that. So a lot of them had sort of had some experience of treating LGBT patients, which was lucky. And all of the ones who had were the same ones that had witnessed discrimination. And we've got here about a majority of it was about 70% of them overall really kind of said that they did not feel comfortable or prepared to address the unique concerns and needs of an LGBT patient coming through a department. And again, they could answer kind of the reasons why, and that was purely around that they hadn't had any clinical or academic education on this. Again, yeah, so there it is, just to say, 13 of them said that they didn't have any training. So the student recommendations, really, I just wanted to know, did people actually want to know more? And did they actually feel like they should have had teaching on this topic? And 21 of them said yes. The 3% that didn't, the 3 people who didn't were all LGBT. So it's quite interesting to note that those who were LGBT believed that, and this was written in kind of an open text, that because they were LGBT, they knew everything that they needed to know. And the 21 others were predominantly of them were the heterosexual counterparts in the study. And then I kind of asked, like, actually, how do they want to be taught? And predominantly, a lot of them want to know about inclusive communication and terminology, and kind of how do we need to treat them, patients like this specifically. And a lot of them wanted guest speakers. So go back to that. So a lot of that was they wanted actually LGBT patients to come in and either come into clinics or come into departments and do some clinical education or come into universities as guest speakers. So we're kind of linking this now, my survey, back to the research that I'd done at the beginning, so the literature review. And really clearly my data was kind of proving that there was a lack of formal LGBT education within radiotherapy, which agreed with the kind of literature review at the beginning. There is a need for a systematic modification for the training curricula, and we really do just need inclusive education and training frameworks overall. So these were the 3 kind of areas that I decided that I think that HEIs and clinical educators need to kind of encompass within their LGBT educational reform. So curriculum development was, I don't think universities should just be covering LGBT in a kind of generalized EDI. I know from when I did my undergrad, ADI was kind of sexuality, orientation. You had the same lesson was how to deal with kind of hearing impaired patients, Alzheimer's. It was all done in an hour session. And I agree, I believe that it should have specific sessions for specific patient groups. So whether that should be e-learning, whether that should be kind of patients coming in, whether it should be a lesson, I left that up to the HEIs, but I said that's kind of what you need to do. Educational methods kind of coming out of that should probably be diverse. I think in some ways you either need incorporation of lived experiences, so you should get an LGBT cancer patient to help you write the PowerPoints and slides that you're using, or you need to get a guest speaker to come in themselves. And continuous improvement. LGBT health is constantly changing, and just cancer is constantly changing. So to make sure that it's made up to date. So the sort of conclusions, and to sort of summarize, was we know that there's a historical lack of education research within this field, that current students, there was vast gaps in their radiotherapy and oncology kind of education around LGBT patients. There's a need for an educational reform, and the attitudes and beliefs of undergraduate students is that this is needed. Someone I know who is doing this, sort of copying my survey as much as they can and kind of citing my dissertation for their masters, and they're going to continue this to the professional field. So it'll be interesting to see in 2 years' time, because they're doing it part-time, whether the data that I've got from undergraduate students will be the same when they actually ask qualified professionals, and to see whether the data kind of aligns up. So kind of now really outpatient. So this is kind of the area where professionals, I'm going to just kind of signpost professionals, academics, anyone really involved in teaching about this topic or actually treating patients themselves. Outpatients probably is your go-to. They are a patient advocate and the UK's only LGBT cancer charity. And you can go on there for patients. If you have any patients, advise them to go onto the patient resources, but they also have professional resources. So they have a lot of slide decks, they have a lot of articles, journals, etc., that's specifically about LGBT cancer. They also, for a donation, will come into your workplace and do a specific kind of webinar or teaching package, and you can discuss with them direct. I am currently working with them to create a student version of this. So at the moment, it's only open to professionals. And coming off my undergrad, I'm trying to kind of get them to make a student-friendly version. They hold the UK's only annual LGBT cancer conference, and that's held on the Saturday, the 8th of November this year. If I remember, I'll put it in the chat. If not, it'll go out on the email, and I'll send it off to Lindsay to add to the recording so you can have a look at it. It is currently online only, as all of the face-to-face tickets have been sold. So this is UCAT. So this is the UK Cancer and Transition Service. This is a patient support for any transgender and non-binary patients. They can either self-refer, so you can, if you have a patient that comes through the department, you can advise them to go and look on their website, and then there is a massive self-referral kind of tab, or you can professionally refer yourself, and there is a tab on there as well on the forms that you have to complete. This service isn't a kind of primary service. They won't take over or treat this patient. It's more for secondary care. So they are there to assist in any of the side effects, any kind of the mental health, the holistic side of them having a cancer diagnosis and being a transgender or non-binary patient. And then you do have Cancer Research UK and Macmillan as well. They do have some good resources on their website. So what's next? I am currently converting my dissertation to a journal. This should hopefully be first draft written by the end of the year. So I'm hoping for this to come out that spring next year. My friend is doing this study, but at professional level. So in 2 years' time, that will be kind of released to the world as well. So they're going to release their masters, and then me and them are going to write an article together comparing the data that I collected at an undergraduate level to professional level, and seeing if it'll be interesting to see if it's the same or not the same. We'll see. Because obviously undergraduate education is very different to the education that people either receive mandated by the NHS or CPD that someone self chooses to do. I'm also completing an MRes at the moment, and that's going to be looking at health inequalities. So probably about the cancer screening. So specifically kind of why LGBT patients have the lowest uptake of the NHS cancer screening nationally as a kind of health inequalitized group. And then probably going forward, I'd quite like to take this in some form to kind of PhD level. So thank you, and sort of any questions? I'll stop sharing my screen now.
Thank you so much, Connor. That was really, really interesting. I was quite blown away by the fact that so many of the community don't go to the doctors and don't attend screening and that kind of thing, which is really That really shocked me actually. Um, but yeah, yeah. There are a few questions. I think you kind of answered a little bit of some of them as we were going through, but do you reckon a survey of this kind could be expanded to qualified staff as well as students? Obviously, students are learning from real life applications mainly from the qualified staff.
Yeah,
And just before you answer that, it's that I think Kerry's put in here that one of my students is currently looking at doing this in Wales. But obviously, it needs to be a UK-wide thing, I guess, doesn't it, really, to look at that kind of space.
I think I do agree that I think it would be interesting to, if you were doing it at an undergraduate level, then like I have done, yes, it needs to be UK wide because Northern Ireland, for example, I think only has one university which teaches radiotherapy. So if I'd only chose to do that one
Mm,
university, it would have been very biased data. I think if you're going to look at it from a professional aspect, yes, you could probably do it by each country. If you wanted to, you could also do it UK wide, but I think it would be good to have a generalized UK wide data set. But I do think if you want to look at it more specifically, interestingly, kind of looking at some of the articles just about LGBT kind of healthcare in general, Scotland and Wales seem to have a better uptake for screening, for example, than England and Northern Ireland. So they're
mm,
obviously doing something well. So it'll be interesting to see whether if you did specifically look at one country data set, whether that would make a difference.
mm. Yeah, yeah, interesting. Um, I Kate's put in there, I think this is a major learning gap across the radiotherapy workforce, and this work has such potential for scalability. And I think she's quite right, really. I think for us to better understand what is needed for this group of patients, we need to understand where our knowledge is lacking, don't we? We really
Yeah.
do.
Yeah,
Um,
so yeah, as I said, my friend's doing this for their master's dissertation for professionals. So I think they start their master's dissertation next year, so they're doing their master's part-time. So it'll be interesting to see whether the data set is comparable and actually whether people, because as professionals, we obviously have that mandated CPD, whether actually people choose to do CPD on this area or whether we don't. And actually whether the data kind of comes across that again quite similarly. I think my predictions will be that it'll be quite similar, that a lot of professionals don't feel comfortable treating this patient group, and predominantly probably because they don't have the training nor
I
the
think, yeah,
knowledge. So it'll be
absolutely
interesting
right.
to
I
see.
think almost needs to be part of your mandatory training, doesn't it, really?
Yeah.
Um, um, do you know whether this is now being taught as part of like university curriculum? Is it a standard subject that now is being taught or
So I know that I've sent it to the SOR, so I've sent it to them to kind of talk to the kind of education board that they choose because they kind of about it. And I know that EDI is taught mandated. It's mandated kind of as by HCPC and NHS education and the SOR that you have to treat EDI. But I can say that from speaking to some of my friends here and at other universities, their EDI was, let's say, an hour and a half session
Mm,
where you'd cover autism, neurodiversity, learning disabilities, race, religion.
mm,
It would all be covered in one section. So you'd only have like maybe one or two slides on each kind of patient group. So
mm,
I think a lot of it should be specified to that patient group.
mm,
It's interesting. I know that probably Naaman's probably on this call, but with his work on different skin colors and skin reactions, I wasn't taught this at all at undergrad. And I now know that the new first years are having a whole dedicated lesson purely on this. And I think it should be that with people's research, the more that we do it, that hopefully higher education and clinical education departments themselves realize that actually you can't EDI doesn't encompass everything, and that actually EDI training needs to be specific to each patient group, and you need to have a kind of education package specific for kind of each patient.
mm. Yeah, no, I agree. Um, have you approached any of the radiotherapy ODNs with this, thinking of scale here and potentially getting a regional approach to training specific to radiotherapy?
No, I haven't because I didn't really know I could. I just was doing it because you sort of have to do a dissertation, but I wanted to do it on something that I was interested in. I knew that if I was going to go further into my research career, that potentially, master's, PhD level, that this would be something that I'd want to do. So if anyone wants to contact me and kind of we can get that. Oh, I've just seen your message, Kate. Thanks. Yeah. If yeah, I think I'd love to kind of get involved with this in a wider scale. That I think this is kind of the area of my research and passion that it it all started actually as when I came across a female to male and a male to female patient 2 days apart in one of my placement departments, and staff just didn't treat them right, and
Mm,
just didn't know how to treat them because they didn't know whether they were treating them as the person that they were arriving with as, or whether they were treating them as the kind of the genderized cancer, and
mm.
your kind of presentations and side effects, they didn't quite know how to deal with it. So I think it's a very important piece of work that kind of needs to be kind of shared out and about.
I agree. And this is a question from me, a purely selfish Radiotherapy UK one. Is there scope for us to provide some resources for these groups of patients in terms of managing side effects? Um, or is that information out there somewhere?
I would say that outpatients is brilliant. So outpatients has a
Mm,
lot of stuff
yeah.
out there. But I don't think there's a lot for um there's not a lot kind of out that there isn't enough out there basically. And I think a lot of the area that is missed is transgender patients. And fair enough, no matter kind of your sexual orientation or gender presentation, the side effect of a cancer will be the same no matter who you are. But it's the person that we also need to treat. And I think some people kind of struggle when you have, for example, a female to male when they're presenting as male, but we're obviously treating, let's say, a gynecological cancer, or if it's male to female, they present as female, but you're treating prostate. We all know biologically that those two cancers can only be, for the better or the worse, male or female, but that person that's presenting isn't male or female,
Mm.
or doesn't fit the kind of the black and white that unfortunately this world seems to fit in. And I think that's the main area that is kind of missed in LGBT care, is kind of transgender and non-binary care massively.
Perry is asking if you've got any contacts for guest speakers. Guess we can link you up after this if there's anybody that you can think of,
Yeah,
Connor. I can certainly link you up with Kerry.
cool.
Um,
I'll put my
put your email address in maybe if you want.
I've put my email address in the chat, so if anyone wants to email me, then feel free.
Okay, great. Well, thanks, Connor. Thanks, everyone. If you're able to stay on, I have got just a few things I want to update you on. So before we sign off today, I just want to say I think we've already mentioned AHP Day from yesterday. So I'm sure there are lots of you on the call today, and just want to say happy AHP Day for yesterday. And you all do such an amazing job, and truly make a difference. So I also wanted to highlight, we've recently been involved in, The Guardian did an article we were involved in looking at patients, and how many basically are missing out on radiotherapy, and what some of the issues are surrounding this. So if you haven't seen it, look out for it. Also, we're doing some campaigning and lobbying on the 28th of October in Westminster. So the charity will be going along with the Catch Up with Cancer campaign. We've got industry coming along and some workforce members as well to talk to MPs, to highlight how radiotherapy needs to be an integral part of the upcoming cancer plan. If you want to do anything to help with this, you can write to your MP to attend this event. They can come and speak to us, and they can find out what's going on in their local area. We have a function where you can write to your MP to ask them to do that, so it makes it really, really easy, and that function is on our website, and the address is on the slide there that you can see. So if you feel that this is an important issue, then please write so that we can speak to the MPs. They can come and talk to us, and we can highlight the importance of radiotherapy and hopefully garner their support. A couple of other things. We have a radiotherapy daily news bulletin that goes out each day. If you don't know about it, then sign up to it. It just tells you what's going on in the world of radiotherapy. It's free. It lands straight into your inbox at 8 a.m. every morning. It's got research, it's got media, it's got all things radiotherapy. If you're interested, do sign up to it. And finally, we'll be getting festive very soon. It's that festive time is coming up, so do follow us on social media for any sort of upcoming details. We've got a festive raffle that we'll be doing, so watch out for that. And all I'm going to say is thank you so much for attending today and for your continued support with the charity. We're really grateful for any feedback with regards to the webinars. So if you have any, get in touch. And I really hope you enjoy the rest of your day. Thanks for